Hi, this is Dr. Daniel Kim. Welcome to Cognitive Behavior Therapy for Obesity, or CBT-OB. This is a phase zero preparatory phase presentation. This is meant to give you an educational base on which we will build therapy sessions with me. If you happen to have stumbled upon this presentation on the internet somehow, I do encourage you to review this for your own education as well. So this is the cognitive behavior model on which CBT-OB is based. Cognitive behavior therapy, or CBT, is a proven psychological treatment that works by teaching you a set of skills through which you, one, identify how situations influence thoughts and behaviors, two, become aware of the connection between thoughts, behaviors, and emotions, and three, improve emotional states by changing unhelpful thinking styles and behaviors linked to negative emotion states. So CBT is a foundation of treating all sorts of conditions such as depression, anxiety, insomnia. Uh, the idea is that you target thoughts. Of course, we also target behaviors, but the key insight is that by targeting thoughts, you can also modify behaviors and feelings, and the way situations affect those things, and then you'll feel better or sleep better or modify your lifestyle so you can lose weight. So in CBT-OB, CBT-OB modifies CBT for treating obesity. In CBT-OB, we teach you the skills of a weight loss mindset. So that's the way we target the thoughts. Um, your thoughts connect situations to feelings and behaviors to work together to lose weight. So you'll see that there's that green arrow that points to obesity. Ultimately, your behaviors, um, uh, the calories you eat, the exercise you do, and things like that, your lifestyle basically determine your obesity. Um, so it helps you create a different, healthy sense of yourself as well. If you'd imagine, if you modify your thoughts, feelings, and behaviors, you also have a different kind of identity. You will maintain a lasting, healthy lifestyle because being a skillful practitioner of these things puts you in control. Uh, just to help you consider how CBT-OB connects to obesity. So if we're thinking about the cognitive component or the thoughts, uh, if you have food and you think, I'm going to eat this food because I spent money on it, that can contribute to obesity. If you think that food is the only pleasure I have nowadays, that can also contribute. As far as feelings are concerned, they can be emotions or bodily sensations, but low energy can lead to not exercising. Anxiety can lead to comfort eating. The behavioral component, these are your actions. You can have automatic, unmindful eating of potato chips. You can be sitting on the couch watching TV, um, and yeah, there are endless variations of these components and how they connect to obesity. We try to use CBT-OB to boil things down in a way that things can be manageable. So, why is CBT-OB different from other treatments of obesity? One, CBT-OB is a collaborative approach. So it's different from talk therapy, where you just talk and are offered advice. It's different from traditional dietary treatment because you're not just focusing on your behavior, talking about which foods to eat. Um, we're trying to train you to become skillful practitioners of CBT-OB. And hopefully within 8 weeks, we want to really get you going. Um, and then you have to put in work outside of sessions through homework or experiments. Really, we modify things so it makes sense for you. You develop personal insight into your own issues, and you make procedures. You plan, execute, review, and modify them so they will work for you. CBT-OB is backed by strong research. It can be as powerful as uh, the pharmacological treatments out there, like Ozempic. Um, and even if this becomes the CBT-OB becomes a part of your treatment in addition to pharmaceutical treatment, yeah, you want both because you'll get a more powerful effect. And finally, this treatment is real important because ultimately, most people can't lose weight because of attrition. They just can't maintain adherence to treatment. So, really, it's about finishing the race. This is going to be a marathon. This is going to help. So CBTOB will have a connection to the long-term behavior goals for weight maintenance, not just weight loss. Uh, CBTOB is meant to help maintain lasting changes in your lifestyle. Um, we use this big study with thousands of people who were looked at. People who maintain greater than 10% weight loss over 10 years tended to have the following behaviors. One, an hour a day of exercise. Two, low energy, low fat diet. So you got to maintain your calories. Three, eating breakfast regularly. Four, at least weekly weighing. Um, and then five, maintaining a consistent eating pattern across weekdays and weekends. So if you want to be able to keep this up for 10 years, you've got to really train yourself. And it's not just doing it or just willpower, but having the skills to really stick to things. So these are the six basic skills of CBTOB that we want to teach you. One is goal setting, two, self-monitoring, three, behavior activation therapy, four, identifying and addressing unhelpful thinking, five, problem-solving therapy, and six, relaxation and mindfulness techniques. In goal setting, uh, for losing weight, the goal of weight loss isn't just losing or lowering the number of pounds on a scale. And CBTOB, we distinguish between two kinds of goals. It's common sense though. Broad goals help you understand the direction you want to go. Specific goals help you take individual steps toward your broad goals. And of course, we start with the broad goals, and they should answer the question: what are the reasons you want to lose weight? You want them to address real aspects of your life, like your health, family, work, etc. And then once you come up with a number of goals, you want to prioritize them by importance. Later, we make specific goals. They operationalize your broad goals, or they help you take steps toward them. They address specific problems that contribute to obesity that you'll identify in your own life. And we want to give them the format of SMART goals. It's a mnemonic that stands for specific, measurable, achievable, relevant, and time bound. We'll go over this some more when we actually do that in earnest. In self monitoring, this is the part that brings CBTOB skills to life. We accurately record your eating and drinking and physical activity. So the idea is to get a realistic view of yourself and your realistic um, weight loss obstacles. And then we make solutions grounded in reality. We gain awareness of what you're doing, thinking, and feeling in the precise moment that you are eating. Um, we talk about real time self monitoring, and we talk about that because we want to be able to interrupt behaviors um, that contribute to obesity. And a lot of times they're automatic and they seem uncontrollable. So even if you don't understand the problem, you want to be able to get to a place where you can interrupt them. And once you can interrupt these automatic behaviors, you can make conscious choices to make that are better for you. And then once you're at the point of choosing, you can plan a lifestyle that works best for you. And so You can incorporate a wide variety of foods, which there's going to be education on as well. And then we introduce exercise and activity in a way that will last in the long term. So, behavior activation therapy, it's very important. Basically, we use this to create opportunities to improve functioning by increasing activity. Weight loss isn't going to happen by doing nothing, obviously. Um, so, by doing things, one, it helps to build and then make concrete this weight control mindset. Um, at first, it can kind of feel like faking it till you make it, but in the end, after you've kind of learned these skills and put everything together, hopefully you'll have this concrete weight control mindset that isn't just in your head, but also um, implemented in your life through your lifestyle. So concretely, it helps you reverse avoidance behaviors, increase physical activity, self confidence. It increases feelings of usefulness and purpose and competence. I mean, again, it helps you create this sense um, um, of this healthy identity. Uh, Components of behavior activation, we break them down into two categories: pleasant activities and active coping or mastery activities. Pleasant activities are pleasant activities, they're pleasurable in and of themselves. So you may have been doing healthy, pleasant activities before, such as enjoying a healthy diet. Um, Certain kinds of exercise. So it's maybe just a matter of starting that up again. Um, and sometimes you just have to find new things that are pleasant. Um, Now, in reality, dieting or losing weight can may not be all fun and games and just inherently pleasant. And so this is where the active coping or mastery activities come in. Uh, Now, they will kind of indirectly be pleasurable. One, because they alleviate or reduce life stressors. So you'll have less stress in the long run, maybe not in the short term, sometimes in the short term. So examples, introducing new exercise. If you just don't like exercise, you've got to do it somehow, um, especially for long-term weight loss or new restrictive diet. If food truly is the greatest pleasure in your life, this could be difficult. But if you're here with me right now, you're at a place where you're ready to make some changes. And so, yeah, we're going to have to cope or master new activities. In the end, though, right? We're trying to decrease stress. We're trying to increase a sense of accomplishment, trying to avoid dealing with issues. We want to be um, skillful practitioners of the CBT-OB mindset. Identifying and addressing unhelpful thinking. Now, we're talking about the thoughts. We're going to target the thoughts. In CBT-OB and in other CBT treatments, unhelpful thinking drives feelings and behaviors. And so there's this picture, see this iceberg. At the top, what's readily visible are the automatic thoughts. Um, and then below that, intermediate beliefs. And then deep down are our core beliefs. So those are our layers of unhelpful thinking. CBT-OB will teach you how to deal with them, and then we'll talk about the three types here briefly. Automatic thoughts are immediate internal reactions to specific situations and events. So we may be unaware of them. Um, uh, they can be helpful or unhelpful. So if they are automatic thoughts that lead to behaviors or feelings that contribute to obesity, they're unhelpful. I mean, automatically, if you just avoid certain types of candy, right, that could be helpful. Really, it's like automatic thoughts like stopping at a stop sign. You don't really think it, or but you do it because it's helpful and adaptive. Intermediate beliefs are assumptions, attitudes, or rules a person forms from life, like ever since childhood, you had certain things happen to you. Usually, it can be stated as a conditional rule and an if-then statement, such as, "If I am thin, then I will be loved by others." So these are not situation specific. They're formed over the course of your life, and we may be unaware of these as well. And so we may have to bring this sort of thinking out to the surface. Core beliefs drive automatic thoughts and intermediate beliefs. These are thoughts such as "I am unlovable," deep down inside, that rule all the other ones. If you think, "If I am thin, then I will be loved by others," this is a belief that drives that. Um, Now, these are really hard to change sometimes because uh, we people generally ignore evidence that contradicts them, even to their detriment, even though they shouldn't be thinking these, even though it may not be true. um, People just have a tendency to hold on to the evidence that supports this sort of belief, and ignore ones that contradicts them, even though it'd be helpful to contradict them. And that's part of what we do here in CBT. These are some important specific thought targets for CBT-OB, and so usually we try to find what you are thinking inside, and target those thoughts. Um, but these are ones that we want to try to plant in you, or sometimes you'll have unhelpful thoughts that are contradictory to these. These are important because they've having these thoughts have. Uh, been associated with more success, basically, reducing attrition, increasing weight loss, and successful weight maintenance. So having high but realistic expectations, I will have high but realistic expectations, um, is supposed to help. Uh, Thinking I am motivated by improving health, not appearance. That's also an important one. I will work to be satisfied with the process. So it actually, if you're doing this and you're just not happy with this process, you're less likely to be successful. So we want you to buy in, to what this is all about, and feel happy about doing this. I will maximize self control and minimize disinhibition. Obviously, you want to be able to uh, control your eating, and interrupt automatic behaviors that contribute to obesity. And finally, I will become confident that I've learned the skills to do this on my own. We want you to be confident practitioners of CBT-OB. In the end, 10 years from now, this is what's going to keep you going. Problem solving therapy, or PST, they're useful for when the root of the problem is a changeable situation and the thoughts associated with the problem are accurate. Sometimes thoughts are not your problem. Sometimes it really is your situation that needs to be addressed. So when you have a thought that is very accurate and you're in a situation where you might be able to do something about it, this is what the approach that we take. We don't want you to take on delusional thinking just to make you feel better. um, so there's a technique to it. It's a solve technique. It's a mnemonic as well. S is for selecting a problem you would like to solve. O is opening your mind to all solutions. L is listing the potential pros and cons of each potential solution. V is verifying the best solution. E is enacting the plan. And D is deciding if the plan worked. And we'll work on this later when we get there. Relaxation and mindfulness techniques are very important as well. We'll teach you this early because you're going to be using this whenever you kind of run into situations where, uh, say, you're dealing with sensation of hunger or stress eating. We use this to reduce unmindful eating. So, relaxation techniques that we will be using: progressive muscle relaxation, deep breathing techniques, guided imagery. All of this is not very difficult. And so we want to get this stuff going early. There's mindful eating, so that when you're eating, you're noticing the texture and the taste and the smells and everything as you take it in. There's praying or expressing gratitude before eating, as well, um, which helps as well. So you can think of phases of CBT-OB. This is phase 0. We're preparing you to enter the active phases of CBT-OB. Phase 1, the aim is to help patients achieve and be satisfied with a healthy weight loss. Ideally, the session is weekly during the first 8 weeks and then every other week afterwards until week 24. There's no one way to do this, but we do want to get you going and going strong in 8 weeks. Um, you can expect to lose about half or 1 kilogram a week, or that's 1 or 2 pounds a week. Phase 2, we develop a mindset and the habits to help you maintain weight in the long term. Duration of about 48 weeks. And then ideally sessions every 4 weeks. So, this is you're not done with this in just a few months. And right, in CBT-OB, uh, this process has been designed to help you reduce the risk of weight regain by using phase 2 to work specifically on that. And at the end of therapy, after this is all done, 48 weeks, 4 review sessions will be scheduled at 3-month intervals to track you. But yeah, that's when we get there, we'll get there. Um, so uh, the durations, as we talked about in the last slide, we did talk about that. We'll focus on these sessions. Session 1, monitoring food intake, physical activity, and body weight. Session 2, changing activity and developing an active lifestyle. Session 3 and beyond, addressing weight loss obstacles. And session 4 and beyond will be addressing weight loss dissatisfaction. And again, dissatisfaction is a big issue here. If you are not satisfied with your weight loss, um, you're less likely to continue or even maintain it. So, again, we don't want to teach you delusional thinking, like to delude yourself into thinking you lost weight loss. We're talking about really achieving some weight loss, um, and knowing the health benefits from doing that, and then doing everything you can to maintain the weight. And then you can try again to lose weight again another time, but this is about building the skills to keep things going over the long term. So if we do a 45-minute session, we'll start by doing a weighing, or if you just weighed yourself earlier that day, you do want to weigh yourself on the day of the session. And then we'll talk about how you feel about current weight loss efforts. That's about 5 minutes. Next 5 minutes, we'll bridge discussion from previous session with current session. Next 5-10 minutes, reviewing the monitoring record and other homework. Next 5 minutes, we'll collaboratively set the agenda for the session and prioritize items. So we'll address issues that need to be addressed during the homework sessions, or reviewing the homework, items relevant to the treatment that patients want to discuss, and we'll introduce new topics uh, based on the need at the particular stage in treatment. Then we'll work through the agenda and agree on homework tasks, 20 to 25 minutes doing that, and summarize current session, exchange feedback um, for about 5 minutes. This is a long list of things that lab tests and things that we want to think about as we address weight loss. Um, it may not be just a matter of uh, decreasing calories you eat, increasing the expenditure. Um, you may have other medical conditions that contribute to weight gain. And also, you want to make sure that you are in a place where you should be trying weight loss. If you are not healthy enough for uh, pursuing weight loss, then you should wait until those things are addressed. Um, so, yeah, we want to make sure that you are in the right place medically before you embark on weight loss. These are a few conditions that are associated with obesity. So these need to be treated separately, apart from just what CBT-OB does, or even just medications for obesity. So you want to make sure that if they're there, you find them, and you are um, in the right place to be addressing those as well. So this is something I encourage you to do now that we've talked about all this. This is what we call a functional assessment, or sometimes it's called a personal formulation in CBT-OB. So this is an exercise that gets you to think about obesity in terms of the CBT model. We focus on behaviors that contribute to obesity. So look at that second column. It says behaviors. What did you do? And you can list a bunch of these behaviors that may have contributed to obesity. They can be emotions, sensations of the body, actions, thoughts, situations, and relationships. So you start by filling in that column with the behaviors, and then you think about what happened before you did the behaviors. Then you think about what happened after the behaviors. Short-term consequences and long-term consequences. And so you can think about all this in terms of the emotions, the sensations, the actions, the thoughts, the situations, and the relationships. Uh, How did this connect? Well, if you look at that, the diagram again, the behavior box is right here. So the antecedents, what happened before, situations, thoughts, and feelings can all contribute to behaviors. And then that green arrow that leads to obesity, well, the consequences, you know, will be the things that contribute to obesity. But again, we want to put things in terms of before the behavior, what the behavior is, and then after the behavior, so that we can get used to thinking about um, 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 how your life happens according to the CBT model. For the purposes of this exercise, you can do this in real time as things happen to you. You know, it's coming up with a piece of paper and writing and making 4 columns is easy. So I encourage you to do that. Or you can sit down and think about situations that have happened to you recently in the past week or today, or things when you can think about or you can recall clearly. And again, this is the purpose of this, to get used to thinking about um, things in terms of the CBT model. Get you comfortable in doing this in real time, so you don't have to feel awkward as you do it. So this is the end of the presentation. I'm glad that you stuck with me to the end. If you have any questions, email me or ask them during session. If you're interested in becoming a patient, also email me, and I'd love to be able to help you achieve a healthy lifestyle, and so you can have a healthy weight. Thanks.